Bismillahirrahmanirrahim. Our first clinical question is what are the causes of a claw hand? Claw hand. Claw hand is just like this, called the claw hand. Okay?
Okay.
What are the causes of a claw hand?
دكتور فيرست مثلا راديال نيرف انجري
Radial nerve injury. No, ulnar nerve injury. Yes, it's ulnar nerve injury. And the second,
دكتور
Dupuytren contracture.
دكتور نفسه هذا
Is Dupuytren contracture is a band هنا جوا السكن band below the skin. It causes contraction of these little and ring finger and to some extent is the middle finger. Claw hand, unilateral claw hand. It is either ulnar nerve palsy and the trauma is in this area, in the middle malleolus, and you get damage to the ulnar nerve, and ulnar nerve is emerging from C8T1. We have three nerves to the upper arms: radial nerve, median nerve, and ulnar nerve. Radial nerve and median nerve coming from C3, C3, C4, 5, 6, 7, 8, and median nerve from T1, 2. While ulnar nerve is coming from C8, T1, supplying the upper arm or the hand of the upper arm. And we say that muscle in the hand, this is the hand, muscle in the hand are 20. 15 muscle in the hand supplied by what? Ulnar nerve. And 5 supplied by median nerve. There is no radial supplying of muscle in the hand. It is only sensation of snuff. This is the area of radial nerve in the hands. Skin supply of sensation only. No muscle supply by the radial nerve in the hand. Therefore, a unilateral claw hand, you should put a differential diagnosis, either Dupuytren contracture or ulnar nerve palsy. Dupuytren contracture, sometimes we see this normal, sometimes we see the alcoholic liver disease, we see Dupuytren contracture, and those with manual trauma. They got a manual trauma and they get Dupuytren contracture. If the question is bilateral claw hand, what are the causes of bilateral claw hand? Bilateral claw hand, this is bilateral claw hand. What are the causes? Bilateral claw hand mean the lesion is in the spinal cord because it's bilaterally. Therefore, first of all, one of the first causes of bilateral claw hand is syringomyelia. A typical patient is a middle-aged female, and they do get sensory dissociation in the hand. And by sensory dissociation, we mean absence of spinothalamic sensation in the hand. It means the touch, it means the pain and temperature absent, spinothalamic being affected, while the dorsal column is normal. The position sense, vibration is normal in the hands. Therefore, the lesion is in cavitation in the spinal cord, cervical spinal cord area. This is syringomyelia. The second one causes is what? Friedreich ataxia. You get bilateral claw hand. And the third cause of a claw hand bilaterally is a Dupuytren contraction bilaterally. Dupuytren in the left hand and Dupuytren in the right hand. you get claw hand, both claw hand. Okay, وقف التصوير.
Okay.
As we said, bilateral claw hand causes either syringomyelia, Friedreich ataxia, bilateral dupuytren contracture, and one other causes is motor neuron disease affecting the cervical region and cause bilateral claw hand. While bilateral foot, claw foot, the causes are the causes are motor neuron disease in the foot, claw foot, motor neuron disease, وفريدريك ataxia, وperoneal muscle atrophy. 3 causes of claw foot. If I ask you, examine the hand neurologically, examine the hand, the upper arm or the hand neurologically, what are the commonest lesion in the hand you should think of?
Spinal injury.
Hand neurologically, examine the hand neurologically. I mean, you expecting something common. What are these common things in the hand?
For example, Doctor, drop of the wrist. We were thinking
Yes,
about the
we probably found a drop wrist and that injury of the radial nerve, and the lesion is in the groove, okay?
Doctor, the second carpal tunnel syndrome.
Yes, carpal tunnel syndrome, the median nerve involving in this canal, in this bridge, there is a median nerve emerging from under a ligament here and come to the hand supplying 5 muscle. Any lesion in this area, which is usually occur in rheumatoid arthritis, pregnancy, hypothyroidism, all these can cause numbness and pain and sensation, pain, numbness and wasting of the muscle. Carpal tunnel syndrome, lesion in the median nerve. This is the common site of the median nerve involvement in this area.
Doctor, also we see tremor.
The third causes of expecting is a carpal tunnel ulnar nerve palsy. We expect an ulnar nerve palsy in the hand. The third lesion commonly seen in the hand, especially in female, is what? Is a cervical spondylosis. Cervical OA, changes in the cervical region. And we know the cervical vertebra are, how many cervical vertebra we have? 7. And we have 8 segment. Spinal cord segment is 8 in the cervical region. Why it is 8 and the cervical vertebra is 7? Because the segment is small than the vertebra. Therefore, we have 8 segment in the cervical region, from C1 till C8. Okay? The cervical vertebra involved mainly by 3 diseases. The rheumatoid arthritis affecting C1 to C3, cervical vertebra 1 and 2 and 3, while ankylosing spondylitis or OA changes, ankylosing spondylitis, cervical spondylosis, or they call it, is involving 4 and 5th and 6 and 7 vertebrae. Okay? In cervical spondylosis, usually the patient is female. Either we get wasting of the muscle, C8, C4, 5, 6, 7, 8, where we get probably diminished reflexes or reverse reflex. If you hit the biceps reflexes, instead of you getting contraction, or probably you get extension of the hand. And in case of a triceps reflex, you get it what? You get a flexion instead of extension. Therefore, the main lesion, if you been asked to examine the hand neurologically, the upper arm neurologically, you should think of the following. First of all, we said what?
Drop. Wrist drop.
Wrist drop by radial nerve. Second,
Carpal tunnel syndrome.
carpal tunnel syndrome. Third, cervical spondylosis. Fourth, ulnar nerve palsy. Ulnar nerve palsy. While if they ask you to examine the rare causes, probably you find the rare causes, rare diseases involving the upper arm. They are CVA, cervical, syringomyelia, cerebellar degeneration, peripheral neuropathy, which are rare in the hand.
Middle cerebral artery.
Okay, these are the main lesion you should look for. The common things we said it are 4, and the rare things is still 4. CVA affecting the upper arm, syringomyelia, cerebellar disease, or peripheral neuropathy, mainly involving the foot, while it's very rarely involving the what? The upper arm. If they ask you to examine the leg neurologically, the commonest lesion are in the legs are what? It is a prolapse disc
Proximal myopathy.
and peripheral neuropathy and foot drop. These are the 3 main diseases affecting the legs. If they ask you to examine the leg neurologically, you should think of the common things. The first of all is a prolapsing disc, and the second is peripheral neuropathy, and the third is a foot drop due to lateral popliteal nerve palsy. Disc prolapse, the commonest site is from C5 S1, where C4 L4 L4-5 and L5-S1 is the commonest site. And if they ask you which disc prolapse is without sensory loss, without muscle affected, and straight leg rising signs absent also, it is L2. L2 without sensory loss, without muscle loss, and it is also rare. Okay, we'll go faster.